So it looks like here I have Anna Pawlowski with an allergy to penicillin, date of birth 5/5/57, and it looks like the doctor has ordered an indwelling catheter insertion. It says here to place a Foley catheter for urinary retention. We're going to go ahead and do that today for our patient. So let's go ahead and see our patient. All right. Sanitize my hands. Hi, my name is Arisss. I'm going to be your student nurse today. Can I get you to verify your name and date of birth for me, please? All right, may I check your wristband? All right, great. And can you verify any allergies that you may have? Penicillin, and what was your reaction last time you were exposed to penicillin? Hives? Okay. All right, let me go ahead and check your record here. All right, so everything does match, so that's good. Anna, why I'm here today is I'm going to go ahead and insert a urinary catheter, okay? The doctor has ordered this because you haven't been able to go to the bathroom in about 8 hours, so all that urine is building up, and we want to go ahead and give you some relief and take that out, and that catheter is going to do that for you. Have you ever had any issues with urinary stricture or any issues when people insert a catheter into you? No? Okay, wonderful. So we can go ahead and get that started for you, okay? So just looking around really quick, just to do a quick safety check here, I see bed is in the lowest position. I see both side rails are up, the call bell is within reach, the bed is locked, there's no spills or anything around here. And Anna, are you comfortable? You are? All right, and I see that you're laying down nicely and you do have a blanket here to keep you warm, so that's wonderful. All right, and what I'm gonna do next is we're gonna go ahead and start getting you into position here, okay? All right, so what we can do first, let's see here. Let me go ahead and close the curtain for privacy. That's definitely an important one, right? All right, so we're gonna close the curtain for privacy here. I'm gonna go ahead and sanitize my hands. All right, I'm gonna go ahead and just put on some gloves here and we can get started. All right. All right. So I'm gonna go ahead and just raise up this bed here to a height that's comfortable for me to work, all right? And then I'm gonna go ahead and just put this side rail down just so I have access to you. So Anna, what I'm gonna have you do is go ahead and just relax your thighs, okay? I'm gonna have you bend your knees and we're basically putting you into a dorsal recumbent position, all right? So go ahead, we'll start with this knee here. Oh yeah, Anna, you're doing great. All right, and this knee as well. All right, good deal. Are you comfortable how you are? You're not? Well, I'll make sure to work as quickly as possible, okay? Just so we can get things going, all right? I'm gonna go ahead and just expose you here, okay? So I'm gonna lift up, all right? So we have adequate lighting in here. I am able to visibly see the urinary meatus here. At this time, I'm gonna go ahead and clean the perineum here according to hospital policy. So go ahead and do that there. And I'm gonna go ahead and remove my gloves here. All right, we're gonna throw this in the trash, that's right over here. I'm gonna go ahead and sanitize my hands. Wonderful. So, okay, Anna, you're doing great. I'm gonna try to do this as quick as possible, okay? I'm gonna go ahead and just start setting up my area here. All right, this is our catheter kit here. Throw this paper away. This is gonna become my new little garbage here. We can go ahead and just set this up right in the corner. This is going to be my little trash. All right. All right, so I'm going to work right in between your legs, okay, Anna? So just be sure not to move too much or anything, okay? All right, you can go ahead and just move your legs a little bit out, just like that is perfect. Still okay? Let me sanitize my hands once more. Can never do it enough, right? All right, let's go ahead and open up this tray here so we can go ahead and start working and get this over with for you. All right. Good deal. We're going to go ahead and open up this blue drape. All right, just like that. We're just touching the corners. We're going to go ahead and just lay this down just like that, and we'll fix it just in a moment. Let me go ahead and sanitize my hands once more. All right. And go ahead and just grab my gloves here. I'm choosing a medium-sized glove. The package is intact. This is the size I am, so that's why I'm choosing it. I'm going to go ahead and just give myself some room here, stay on the corner. We're going to open up these sterile gloves. All right, using sterile technique, we're going to go ahead and put on one glove at a time here. good deal. And we're putting on our other glove. All right. Now we have our sterile gloves on, we can go ahead and maneuver this. I'm going to bring this a little closer just to your body here. All right. So just like that. All right. You're doing great. I'm going to go ahead and pick up our fenestrated drape here. We're going to go ahead and just wrap this around you. We want to make sure we have a clean area here. All right. Just like that. While I'm doing this, we're being sure not to touch any of the blankets with our hands to keep everything sterile, okay? I'm gonna go ahead and just open up my tray here. All right, and first I'm gonna take my cleansing fluid and I'm gonna go ahead and pour this all over my cotton swabs here. So pour that in. We're gonna go ahead and just toss this in the trash right over here. I'm gonna go ahead and open up my lube packet here. I'm gonna pour this into my tray. All right, great. So we're gonna throw away that lube there. All right, looking good. So I'm gonna go ahead and just check out my catheter bag here, and I'm gonna make sure that it's clamped. And it is clamped, so that's good. No pee will be coming out of there. So that's wonderful. We can go ahead and carefully take this off of the catheter bag. We can throw that away in the trash. All right, what I'm going to do with this is I'm going to go ahead and dip it into the lube here. So we're going to get it nice and lubed up. All right, while that's getting lubed up, we're going to go ahead and attach the syringe here. All right, just like that. Very good. So now that everything is getting going, I'm going to go ahead and touch you now, okay, Anna? So I'm going to go ahead and just open you up here. I'm going to spread your labia here. I'm going to take my forceps, and what I'm going to do is I'm going to take my first cotton ball. I'm going to go ahead and the far out labia, I'm going to go ahead and clean from top to bottom. And I'm going to take this away from my sterile field. I'm going to throw away my used cotton ball. The next one, I'm going to go ahead and clean the nearest labia from top to bottom. And I'm going to take this away from my sterile field, throw it in the trash. I'm going to use my last cotton ball here, and I'm going to go from top to bottom. All right, so everything is clean there. I'm going to go ahead and throw away my forceps. What I'm going to do at this point is I'm going to go ahead and take my catheter, and I'm going to bring it closer to me here. Okay, all right. And go ahead and bear down for me, just like that. All right, I'm gonna go ahead and insert this about 2 to 3 inches. Oh, I see urine. All right, wonderful. I'm gonna insert it about 1 to 2 inches more, just like that. I'm gonna go ahead and just stabilize this here. I'm gonna go ahead and push in 10 milliliters of sterile water here. This is gonna inflate that balloon. All right, so that's inflated, that looks good. All right, we can go ahead and release that now. And we're gonna go ahead and just remove this catheter, remove the sterile water. We're gonna give this a little tug here. All right, the balloon is catching, so that's good. I'm gonna go ahead and just bring this over. We're gonna give it some slack here, and we're just gonna tape it right to the patient's leg so it's secure. This bag is actually gonna hang down, and it's going to clip onto the bed on an unmovable part. So we're gonna go ahead and put it there, which is right there. And it is unobstructed, so that's good. Everything looks good here. Anna, you did wonderfully, okay? So you did a great job. At this point, we're all set. Now at this point, what I'm gonna do is I'm gonna go ahead and I would discard all of my materials. I would remove my gloves, I would sanitize my gloves after removing them, and then I would go ahead and document. And I would document any assessments that I did, and I would also document any measurements of urine as well. And I would specifically mention the clarity of the urine, the color of the urine, the amount of urine, and also the amount of sterile water I pushed into the balloon, and also the sizing of the catheter tubing that I used as well. After that, I always complete everything with another safety check to make sure that the side rails are back up, that the bed's in the lowest position, patient has call bell near them, and I would go ahead and open up the curtain, sanitize my hands again, and then we're done.